I'm Emily Campagno.
I'm Guy Benson.
I'm Shannon Bream, and this is the Fox News Rundown. Wednesday, June 9th, 2021. I'm Lisa Brady. For decades now, crack cocaine has been treated differently under federal law than the powder version. Could changing that help answer calls for racial justice?
It is time to pass the legislation that would eliminate that disparity, and I do believe that would increase trust and confidence and fairness in our system.
We speak with Arkansas Governor Asa Hutchinson.
I'm Dave Anthony. With so many people vaccinated, COVID is on the decline, but not everywhere. There's been a spike in some rural parts of America, more cases than ever.
Honestly, it's been a perfect storm of things, but unfortunately, I think a perfect storm that could happen anywhere.
And I'm Jimmy Failla. I've got the final word on the Fox News Rundown.
You may have noticed a pattern in the national headlines lately. Crime on the rise. Not only shootings, but hate crimes and other attacks, often raised by critics of defunding the police as a reason to increase funding and manpower instead. Cities have responded in a variety of ways.
This is the first time in this country that the ATF has partnered with a local police department in this manner.
New York City Mayor Bill de Blasio announcing Tuesday that agents from the Federal Bureau of Alcohol, Tobacco, and Firearms will be embedded with NYPD officers to help reduce crime by finding illegal guns and getting them off the streets. New police crime stats show shootings up more than 68% in New York City compared to the same time last year. In Minneapolis, where the death of George Floyd fueled mass protests for racial justice, and where a now former officer has been convicted of murder, some residents are suing the city and the mayor, accusing them of failing to keep residents safe and arguing in part that a city council move to decrease police funding has led to resignations, contributing to escalating crime. But in general, debates about policing reform and criminal justice reform aren't really new. And there's a renewed push right now to address a long-standing disparity, the difference between powder cocaine and crack cocaine under federal law, which critics say has helped fuel distrust in law enforcement, especially in black communities, for decades.
When it comes to crime, you have to look at every area in which crime is a problem.
Arkansas's Republican Governor Asa Hutchinson is also a former congressman and was head of the Drug Enforcement Administration under President George W. Bush.
You know, here in Arkansas, we've had some level of increase in crime, but we've seen it go down over the last decade. We've seen it start creeping up again. And so there's a lot of combinations in that. I don't think you can point to the fact that we're not arresting the right people. I think the fact is that we are arresting people, we're prosecuting people, but we need to make sure that we have the long enough sentences for the violent criminals, and some of those come out and they recycle into the life of crime. We've got to concentrate more in terms of our reentry system so that we can have better supervision, better parole supervision and reentry work to help them get a job. But ultimately, if they're just going to cycle in and out in terms of violent crime, we need to keep them longer. We've got to have tough prosecution. We've got to arrest the right people. And then we've got to have effective reentry programs.
There is a problem, and many in law enforcement have acknowledged it as well, an issue with communities, especially black communities, trusting law enforcement and the criminal justice system. What can be done to repair and strengthen those community relationships, or is that even possible?
Well, that's one of the reasons that I support eliminating the disparity in sentencing between crack cocaine and powder cocaine. And I do believe that is a factor, one factor, and that is a lack of trust of the system. But, you know, it goes much beyond that. And whenever you have crack cocaine that is sentenced 18 times more in length than powder cocaine, and when you look at the fact that the African-American population constitutes 81% of all crack convictions, that means the African-American community is getting prison sentences that are 18 times longer simply because of that disparity. Now, what does that mean on the street? It means that there's a lack of confidence in equal treatment under the law, which is foundational to the criminal justice system. So I do believe it's a factor, and that is one of the reasons that I support eliminating that disparity, which I've actually worked on for more than 20 years since I was in Congress and head of the DEA, and we've made progress on it, but it is time to pass a legislation that would eliminate that disparity, and I do believe that would increase trust and confidence and fairness in our system.
I know that gap between the way powder cocaine and crack cocaine are treated in federal law, I know that gap has been narrowed over the years. When that disparity was first created, was it intended to target people of color and poorer communities, or did it just end up doing that?
Well, I think it just ended up doing that. I mean, at the time, which was in the 1980s, we had an epidemic of crack cocaine across the country, and many times it was associated with violence, and so Congress naturally stiffened the penalties on crack cocaine. Part of the belief was that there was something in the chemical properties of crack cocaine or its association with violence that it ought to have greater penalties than powder cocaine. But over the years, I think law enforcement has recognized that disparity is not based upon a good foundation, and that it ought to be eliminated. That's the reason they did eliminate or reduce that disparity from 100 to 1 down to 18 to 1, which is tremendous progress. That was a bipartisan bill by Senator Jeff Sessions and Senator Dick Durbin. And so that was a success story. That was progress. But I do believe you can say that it's more importantly to completely eliminate that disparity. But no, I don't think it was started out on a racial basis, but the impact is disparate in terms of its racial treatment, and so you have to worry about that. That's the outcome of it, is that we have more African Americans spending longer time in prison than those that use powder cocaine, and that's a racial disparity that is not good for our system and creates distrust.
When it comes to law enforcement, Governor, are you hoping for action in Congress on police reform, or would you rather they leave as much change as possible up to the states?
Well, we have enacted some reform measures here in Arkansas that increases the training for our law enforcement. It also makes sure that we have a database of those that are fired because of excessive action that's not authorized. And so we've taken some reform measures here. I do believe that there can be some national steps that are taken, but you've got to be careful not to undermine the authority of police, the funding of police. You've got to stand behind them because they're the ones that keeps us safe. I know that Senator Tim Scott of South Carolina is working hard on reform legislation, and this is something our party should be able to agree upon, but I hope that they'll continue to work on it, but present it in a way that increases training and accountability, but does not undermine, destroy the confidence that we need to have in our law enforcement officers.
There's another issue that's kind of been in a tug of war lately between Congress and states, and that's voting rights. And even without any evidence of widespread fraud, there are many Republicans who feel tightening voting rules is a matter of election security and integrity. So I'm wondering if you think that changes made in Georgia and Texas are being unfairly targeted and branded as restricting the right to vote.
I do think they're being unfairly targeted. The sound bites about not allowing water, for those waiting in line. I think those are just catchphrases, and the fact is that they're trying to protect the integrity of the ballot. And we've got to be able to change the rhetoric and the debate where it's not security versus access. We've got to increase access and increase security at the same time. And that's my objective, is that, voter integrity is the right approach. But at the same time, in Arkansas, we've increased our early voting and the access to that. Absentee voting is fine. A longer period of time to vote is fine, as long as it's accompanied by the integrity measures. And so you can accomplish both, and that's what our focus should be.
I know that you've known both victory and defeat at the polls over several decades now. Are you concerned at all about where the Republican Party stands right now, and what would your message be for the party heading into the midterms? My message would be, let's focus on the Biden-Harris administration and where we believe it is going the wrong direction. Define the differences in terms of policy and substance, and not by personal attacks. And we cannot win in 2022 by making the race about one person or one personality. We lose under those circumstances, and we have to have the party that's based upon principle to win. And those are the simple principles of restrained government, individual responsibility, strong national defense. These are things that are historic principles of the Republican Party. That's what we've got to get back to. And when we do that, we win. It cannot be about a division. It can't be about one personality. It's got to be about what we really believe and the differences with this administration. Arkansas Governor Asa Hutchinson, thank you very much, sir, for your time. We appreciate it.
It's great to be with you. Thank you.
This is Jimmy Failla with your Fox News commentary coming up.
The pandemic isn't over, but COVID is on the decline, averaging under 15,000 cases a day across America the past week.
Yet another decrease of nearly 30% from the prior 7-day average.
And CDC Director Dr. Rochelle Walensky says there's been
a decrease of 83% in hospitalizations since January 9th of this year.
And vaccinations are a big reason. More than 300 million shots in arms so far. But in some parts of the country where more people are wary of the vaccines, COVID's not fading. It's spiking.
Honestly, it's been a perfect storm of things, but unfortunately, I think a perfect storm that could happen anywhere.
Dr. Kendal Geno is medical director for the Linn County Health Department in Missouri, where they had their worst COVID surge yet in May. Linn, in a neighboring county, topped the New York Times tracker for most cases per capita in the country.
In mid-May, we experienced a spike in the number of people that were experiencing COVID symptoms and who then subsequently tested positive. And since that time, cases have been going up until, fortunately, recently, it looks like things are maybe leveling out. But we had active cases that were higher than any that we had ever experienced in the pandemic. This hit all around the same time as graduation was happening and graduation parties. And then to top it all off, we also found out that we actually did and do have the Delta variant of the COVID-19, of the coronavirus that's had been known as the Indian variant, but now it's known as the Delta variant, which is more infectious. And so all of those things combined, plus our vaccination rate in Linn County especially, and in Livingston as well, especially in the age group under 50, is pretty abysmal. It's pretty low. A lot of folks who are elderly and a lot of the long-term care facility residents got vaccinated, but a lot of folks, a lot of vaccine hesitancy in individuals under 50. And I think that all combined to cause the spike that we're currently seeing.
All right, there's a lot to go through there. Let's begin with how this came up in the middle of May. You guys You had to be surprised, right? I mean, April, were you seeing any cases anymore? Was COVID
No.
was gone pretty much, right?
Yeah, pretty much. Yep. There were several weeks, maybe even a month with absolutely zero cases.
And suddenly it comes out of nowhere.
Yep. In 1 week, we had 21 active cases.
Right.
And then from there, by the next week, we had 85. And then we topped out at 204, which is about one active case for every 60 people in Linn County.
All right, because you're a pretty rural area, right? You don't have a lot of residents. So about
Correct.
12,000, you say. So that's
About 12,000.
one out of 60. So if you do the math on that, that means that would be the same if this was America and not just Linn County. That would be 5.5 million active cases, which is really something considering we've only had, I shouldn't say only, but we've had 33 million the entire pandemic. So this is a large number for you guys, and obviously you were surprised. So what did you do about it?
Sure. So, we very much made a lot of the same recommendations we had been making all along, which unfortunately are, as far as masking, like not gathering in large groups, making sure that people are isolated and quarantining appropriately. But I'll tell you, it's a really hard sell when every time people turn on the radio or the TV, it's like, COVID's improving. It's like, well, but wait, not here.
And then you had the CDC guidance also in May that was like, look, you don't even have to wear masks anymore outside and all that kind of stuff. So
Right.
you were countering a very difficult message to defeat.
Absolutely. And not that was in context in the country, not that was wrong advice. It's just whenever your case counts are as high as they were in Linn County, we had to have other guidance. We just said, look, even if you're vaccinated, you should wear a mask right now because the cases are just that high at this point. And we were seeing lots of what appear to be reinfections, people that tested positive for COVID back in September, October, and were sick, improved, did great, no problem, and then became ill again. And this, in May, and again tested positive.
Now, do you know why that is? I mean, I know there were a lot of people talking last year, people who were like, who wanted to just have these COVID parties, get it over with, get infected, and then you'd be immune forever, people were thinking. Is this that COVID was still in their body, or they actually got a new infection?
And therein is that's a fantastic question. And we don't have the capability as tiny rural health department to be able to tell you that, because what it comes down to is that what you have to do is to prove reinfection, you really kind of have to test them and figure out what kind of COVID they had the first time. So you have to actually type it the first time they get infected. And then you have to type it the second time too. And we're not doing that, of course.
Right.
No one really is. And so, it looks like that we're seeing reinfections. Thankfully, no one has died as of yet from this particular wave. We have had roughly about the same amount of hospitalizations, though, as previous, and some ICU stays as well. I think the biggest difference, though, is that we have seen that really in our little, tiny population, the vaccination is working, because we're not seeing any so far nursing home cases like we had in November and December, because those populations are really vaccinated. And so even though we've had employees accidentally expose residents, who we haven't seen that infection then take hold. And of course, just like in most of the country, that's back in November, December, that's where we saw many of the deaths coming from, were from our long-term care facilities.
Okay, so these people who were infected in May and maybe in early June, they're all unvaccinated. And so, or most, is that better to say most?
The vast majority. I don't know. There may have, again, for patient privacy and all of that, I believe we have had at least a case of a vaccinated individual that did then test positive for COVID, but the vast majority are unvaccinated.
Dr. Geno said vaccination rates were abysmal for those 50 and under. Well, here are the numbers as of Monday in Linn County, Missouri. About a third of the total population has had at least one COVID vaccine dose. Nationwide, that number is almost 52%. And if most of the elderly there are vaccinated, it shows how many younger people in that county don't want the shots, though the recent COVID surge has changed a few minds.
To some degree, we have seen uptick in vaccinations in the area. I think when there's a clear and present danger, then it's a little easier to go ahead and make the jump to get that vaccine. Mm-hmm. As far as reasons, oh goodness, I mean, it really varies depending on the person that you talk to. You know, some folks have what I would nicely say sound like somewhat fringe beliefs about some concern about, even microchips or, things like that being being implanted, all the way to less fringe ideas, just of concerns of reaction to the vaccine, or that they feel like it's too new or things like that.
It's an unproven vaccine. It was only emergency authorized, and all of that.
Exactly.
What do you try to sway them or change their opinions?
Sure. I to be honest, I read the person and my relationship with them, right? And then I do my best from there. And we talk about how, when I got the vaccine as a healthcare provider back in December, I can say that, okay, maybe it was a little bit risky at that time, because only, 50,000, 60,000, less than 100,000 people had it, and only for a few months. But now we've had millions of people who have had it. And it's been months and months and months, and so, I just tell them, like, for me, I'm about as sure of this vaccine as I can possibly be about anything in medicine at this point, that it does seem to work and with very, very minimal side effects.
What about kids? How many of these infections were children, and how did it affect school? I know you talked about graduations.
Yep. So it would have impacted school a lot, because we did see several in some kiddos in school age, certainly in high school age kids. We saw are part of this spike. Really, though, school ended right around the time that the spike really hit, because school let out, I think, a week after we saw that initial 20 case jump all of a sudden. So we probably would have been in the situation where we might have even had to, just by simple fact of people being on quarantine and staff being on quarantine and all that, it would have negatively impacted the school. But again, it was already let out for the summer.
So at this point, you sound optimistic that you hope that wave has crested and you're on the other side, and maybe this
Correct.
Whatever spike you had is ending?
That's I'm going to tentatively say that today, because numbers have dropped a little bit on the day-to-day. But again, as we all know, or as we've learned through this whole thing, as we've kind of become epidemiologists, we have to look at that 7-day average, and certainly that's come down. And so again, we're cautiously optimistic that we're on the good end of this. My concern is for neighboring counties, right, and other places in Missouri where the vaccination rates are just as, or even in the entire Midwest where the vaccination rates are just as bad, because all it takes is just one person, right, to carry a variant into your into your neck of the woods, and then could totally be in the same situation we are.
Dr. Kendal Geno, Medical Director, Linn County Health Department in Missouri. Thanks for sharing your story. We hope that it does peter out and get a lot better. Thanks so much.
Yeah, absolutely. Thank you.
From the Fox News Podcasts Network, subscribe and listen to the Trey Gowdy Podcast. Former federal prosecutor and 4-term U.S. Congressman from South Carolina brings you a one-of-a-kind podcast. Subscribe and listen now by going to foxnewspodcasts.com. Subscribe to this podcast at foxnewspodcasts.com.
It's time for your Fox News commentary.
Jimmy Failla.
What's on your mind?
So President Trump told the North Carolina crowd he's leaning towards running again. And the crazy part is he could win if all of his supporters get out of jail by then. Relax, folks. I've got to make fun of both sides because these days, the only time comedians hit both sides is when they're kissing Democrat butts. But as for Trump running again, that didn't shock me half as much as suggestions that Joe Biden was thinking about running again in 2024. Folks, Biden didn't run in 2020. The dude stayed home the whole campaign, mumbled his way through a couple of Zoom interviews when the teleprompter went out. Most guys I know campaigned harder to be president of their fantasy football league than Biden did to be president. But technically speaking, Joe's in charge now, and the only thing he's doing a good job of is calling our country racist. Biden wrecked the border by repealing Trump's policies. He crushed 10,000 energy jobs by killing the Keystone Pipeline, and he totally caved to the teachers' unions despite all the available science saying it was safer for kids to be in the classroom. Biden would be 82 in 2024, and while no president has ever held office at such an advanced age, it's his policies that'll make him old news.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.